You're only a week and a few days out.
Yep.
And you're healing beautifully.
Unbelievably.
Yeah.
I don't know. I knew from the moment I met you guys that this was the right thing.
We decided to do a mini lift because at 43, it's not crazy to consider a mini lift in general. So through a mini facelift or a facelift hidden scar close to the hairline, we're able to access the majority of the area of the face where it was injected and remove it. So that's kind of in a nutshell what was done.
I don't know. I just had a good feeling. And obviously, you're the best. Highly recommended.
I'll take it. Okay. Hi guys, Dr. Solomon here, and I want to welcome you back to another episode of Unfiltered. Today's podcast, we're going to be talking about the topic of filler complications, mini facelift, and we've brought a guest in, one of our patients, to talk about her experience. So we're going to turn over to Nancy, who's going to sort of run the Q&A here.
Hi, everyone. So the reason we are covering this topic is because we did have our lovely patient, Sarah, come to us. She's 43 years of age, and she came to us because she was had experienced complications from filler. She had developed some granulomas. She was feeling sort of alone in the universe, not sure where to go and how to deal with the complication. And when she met with us, we talked to her about how to remove the filler, and the optimal way was with a mini facelift procedure. So we're sort of covering two topics at once here today. So I'm going to hand it over back to Dr. Solomon. Why was the mini facelift the best option to remove filler?
Okay, well, I'll back up a little bit. So we don't want to scare anyone off fillers. We do a lot of filler at our clinic. I've been using injectable fillers for many, many years, and fillers fall into two different main categories: long-acting or permanent fillers and temporary fillers, and they each have their own unique potential risks associated with it. The risks are quite low, especially when done by experienced injectors, but they're not zero. Typically, if someone were to develop a filler complication, it could be an acute complication, the commonest being and most deadly complication would be if the filler were injected into a blood vessel, and that can cause actual damage to the skin. But fillers also can react with someone in a way that can form lumps and bumps, and that can happen more commonly with long-acting filler, and some of the products that were around in Canada were actually taken off the market. Liquid silicone was actually banned as an injectable substance in Canada, although it's still available in other jurisdictions. But that potentially had some irreversible complications associated with it. Temporary filler can also rarely cause granulomas, which are an inflammatory lump, a reaction to the product. And that's what happened with Sarah. So we'll just give you sort of a summary. If someone presents with a filler complication, it's typically managed medically. We dissolve the product. In some cases, we require other things on top of dissolving. If someone is to develop a granuloma, like an inflammatory mass, there are some other things that can be done, such as injecting cortisone. There's some oral medications that can help reduce inflammation. And that's normally where you would start, and that usually will take care of things. What's rare about this case is that all of those things were done by other clinicians, myself included, who tried to dissolve the area on Sarah's face where she had formed these like rock hard masses, and I'll let her tell you more about it and her journey. And then we felt that the only last way of removing them would be surgical. Surgery obviously can cause scarring. So if we were to remove it with direct excision, with cuts directly over the lumps or bumps, it wouldn't be like a safe alternative, and certainly would be disfiguring. So through a mini facelift or a facelift hidden scar close to the hairline, into the ear and around the ear, we're able to access the majority of the area of the face where it was injected and remove it. So that's kind of in a nutshell what was done. But I'll turn back to these guys to ask Sarah to describe, what happened exactly, her journey, how she felt about it, what options were given, and then what we did for her.
First off,
Start from the beginning.
Start from the beginning. Was this your first filler treatment that you've ever had?
No, it was definitely not my first filler treatment. My first reaction to filler, absolutely.
So you've done it previously over the course of many years?
Yes.
Okay, so this was just a new product that you hadn't used before.
Yeah, and that being said, I mean, I don't think a lot of people are aware what product they are being injected with. So
yeah, that's true.
I don't see the bottle as they're pulling it out. I do know when I saw the records that it was a legitimate product.
And again, for our listeners, a lot of people, because we posted a little bit on Instagram about this story, people wrote in, what is the product? What type of product? So this was a hyaluronic acid product, not a permanent product, as I may have suggested in one of the discussions. So there's technically a temporary product, which historically we see complications from, but they're rare and it's dissolvable. But in rare circumstances, that's not what happens. Sometimes it can cause some chronic inflammation. So Health Canada approved, legitimate product. We're not going to name it because we don't want to sort of focus on one product, because I've seen this happen in other patients from a multitude of products that are on the market. But this product was new for you, and you had, for whatever reason, a little bit of a reaction to it. I'll just say one other thing, which is interesting, is that hyaluronic acid is the main ingredient of temporary products, but there are different manufacturers, different ways to manufacture. And the biggest differentiator between the products is something called cross-linking. And different companies have different amount of cross-linking. Cross-linking is how the hyaluronic acid, which is a sugar molecule, is bound together for longevity. And some companies use more cross-link, some use less cross-linking. So I'm not sure in this particular case if the cross-linking was different, but there were a couple of products on the market that had longer, they were marketed as lasting longer and they had more cross-linking. And some people would almost develop an autoimmune reaction, an inflammatory reaction. Yours was sort of reminiscent of that type of reaction that I've seen in the past from a different commonly used injectable product.
So you had your filler injection. Where were you treated, and how soon did you see
it was in the
complication?
jawline and the chin area, and I think it was probably about 4 or 5 months after. Others around me started seeing a difference in my face. They started seeing my jaw like protruding outwards, I would say more so than my cheekbone. So I didn't really see it. I think that's one of those dysmorphic things where you're looking at yourself in the mirror, you don't see yourself from the peripheral vision. It wasn't until I was doing some videos for work that I saw what everybody else was seeing, and it was looking a little strange. So that's kind of when it started, about 3-4 months in, and I went for my first dissolving to get rid of it. I think all in all, total, it was around 7 times, and it was clearly infected. I was on many different medications for inflammation, antibiotics. It was even drained 6 times with like an 18 gauge needle. It was pretty big, sucking out all that fluid, but it still just kept coming back. And then that is when I sought out my family physician to see what we could figure out, but they didn't know what to do with me. And then that's when I started cold calling basically every surgeon and dermatologist in the city that I could find on Google.
And what was the response?
Nothing. No one wanted to see me. It was
Nobody
only
wanted to-
you guys.
Nobody wanted to take on a complication.
No. Especially something that they didn't do. They did, so no one really wants to get into that correction.
Well, I will say Dr. Solomon's always, he wants to help people. And then we first tried to dissolve your filler as well.
Yep.
Was there any action, anything come from that?
Nope, and I knew there wouldn't be. But I think seeing is believing in a lot of cases. And especially because it was going through stages of looking really, really bad to being covered up. And then it was just like a lump that no one would really know unless I pointed it out. So it was making me feel ill. I knew something was wrong. I knew it had to come out. It was almost as if, remember a long time ago when everybody was going through the encapsulation through breast implants and they were becoming sick.
That's right.
And
People
like
were saying they weren't
symptoms just
feeling well.
seemed really strange. I felt like I was going through that same thing and it was just being dismissed. And I was getting well, you look good. You look pretty. You look fine.
Well, you're beautiful.
It's
People are
but
going to
I'm
say
not
that.
fine.
Were you feeling unwell?
I was feeling unwell and I was starting to get different symptoms like autoimmune symptoms, which I've never experienced before because my immune system is like Fort Knox. Nothing gets in. So I knew something was wrong and I knew my body was literally trying to push this out of my face. And on one side of my face, it was literally like bubbling to the surface, just like pushing out.
Well, when we saw you, you were already now well into this journey. And then we gave you hyaluronidase treatment as well. You said nothing came from it. So then you came back to see us about 4 weeks later. And then the conversation now is turning towards
what
surgery.
next?
What else is there to do? And surgery became the next best option.
Yeah, so, at 43, we occasionally will offer facelifts separate from complications related indications for surgery. So it was my thought that, you didn't really need a facelift. You were looking terrific, but I think you felt that if we were to go in through a facelift incision, you might as well get a mini lift done at the same time. So you were also noticing some very early signs of aging along the jawline. Some people who've had filler also start to get a little bit of the stretch effect, and then it goes back down and their tissues are a little bit more lax. So in rare cases, it can almost create maybe a bit of a propensity to needing surgical intervention at a younger age. So
all that wear and tear, I think, really did do a number on my jawline.
yeah, and I think there's stuff going out on the internet where some surgeons are speaking negatively about filler, and then some dermatologists are getting offended by it. The truth is that all of these are great treatments when done safely, but there's always potential risk no matter what you do, whether it's injectables, whether it's surgery. Things can go sideways or bad. So you just had a very unusual bad situation, which I'm thankful.
Lottery.
You won the bad luck lottery, but we were able to, I think, manage it effectively. I think my point was that we decided to do a mini lift because at 43, it's not crazy to consider a mini lift in general. And I thought that would be the best way of accessing the product, removing it, and at least giving you something positive out of it. So, by tightening your jawline, potentially you would have waited another 5-10 years before you did a facelift. I think you were open to the concept of it to maintain your beauty, but doing it a little bit early, we sort of dealt with the complication. And I think so far your result from your mini lift, you're only a week and a few days out, and you're healing beautifully.
Unbelievably.
Yeah.
She looks beautiful. You'd never know she had surgery 10 days ago.
Yeah. So I think I think like it's a net a very difficult situation where we're happy that the outcome so far is extremely positive.
Oh yeah, I could tell immediately, like already, like the next day, I could tell it was out of my face.
I'll describe what I found surgically just for the audience. So, we went in, there's normal tissue planes, and then where the injectable product was. In your particular case, it was injected in different layers, but it was in the deepest structure. So we had to go into the SMAS layer, which is the deep plane area of the face that we work in with deep plane surgery all the time. And then we went in, it was actually injected near your masseter muscle, which is the muscle that wraps around your jawbone. So that's actually a very, very deep structure. We had to be very careful there. The biggest risk is that we damage a vital structure such as a nerve, which could potentially cause facial paralysis. So that's obviously why no one really wants to operate on these types of cases, is there is some significant risk that you're taking on when you're operating on a patient with injectable filler. And thankfully, it was sort of isolated in different pockets, so we're able to remove it. I think we got pretty much all of it out. We then washed out the area. We put some antibiotic lotion like right over the area to kill off any potential bacteria that could still be living within what's called a biofilm, where bacteria start living within an encapsulated almost micro abscess, and therefore the antibiotics can't really get into the area. So we physically removed it, then we antibiotic directly onto the area, and then we did the lift, and that was it. That's basically where we're at. And you've had a smooth course, and we're going to have to just keep an eye on things to make sure that it's completely, that you're cured.
Hope so.
I think you
I
are.
feel like I am. Yeah.
Does that give you reassurance, knowing how much work went into making sure that he cleaned the area?
Well, I saw the video.
Yeah.
So, I mean, I saw what
We do like to video our procedures sometimes, also for the patient's medical records, and just in this case, so we could show Sarah what we did.
Yeah, it was interesting to see because I'd had 3 ultrasounds prior, so I kind of knew the depths of it, and that's why I was a little bit wary of how is someone going to fix this? Like, yeah, it's not like, oops, your pinky doesn't work anymore. This is your masseter muscle. It's kind of important. So it was important that I found somebody who I could trust and knew was going to do a great job. And I don't know. I knew from like the moment I met you guys that this was the right thing. And if you guys would take me, that I had to go for it.
Well, thanks for trusting me. I will say one other thing. I had a patient come in today, and I think because we posted your case, now we're seeing a lot of people with different complications. But so some people have different fillers. So permanent filler have a different sort of algorithm of treatment, sometimes more limited, sometimes discretion's a better part of valor. It's better to just leave it than to mess around with it. The one lady that we saw earlier today had silicone injected, the product that's banned in Canada, but she had it done in another country. And in those circumstances, it's sort of all over the place, and you have to be very, very careful. Like, you may not want to remove it. It may be impossible to remove it all, whereas it's a different situation. So I'm saying that mostly because if there's other people out there with permanent product that have it all over the place, we certainly are happy to see you and see what we can do, but it may be not worth the risk benefit ratio of whether to remove it or just leave it alone.
I just want to touch on one last topic, the healing process. You are now 10 days post mini facelift. Let's
Yes.
focus on that for a moment. How has it been for you? What was the recovery look like? Like, you make it look like it was super easy just because you look so beautiful on day 10.
Thanks. I feel like it kind of was super easy. I don't know if it's because I've also been pairing it with the O2 hyperbaric chamber, which has also helped with the healing process. I feel like I skipped over the dark blue purple bruising zone and went straight into the yellowing, which wasn't too bad. There was some slight swelling. I mean, I'm still a little bit swollen, but honestly, the healing process has been a piece of cake.
That's great.
Except for the sleeping sitting up. I'm still getting used to that. And
Just
when
slightly
can I sleep
elevated.
on my
That's all we
side?
request. You don't have to sleep sitting up completely, but yeah, slightly elevated.
Yeah.
It's a little bit of a challenge, but it's just temporary.
I mean, I know it's good for anti-aging, but I'm over it. I'm just going to go back to mashing my face in the pillow.
Okay, perfect.
So another
Well,
week.
Yeah, so we're going to be seeing you over the course of the next few months, making sure everything's good, follow you through the healing process, but I think you're like 90% there.
I think so too.
And thank you for trusting us.
Yeah. Well, I don't know. I just had a good feeling. And obviously, you're the best. Highly recommended.
I'll take it. Okay. So to recap, guys, we don't want to scare you off fillers. This is a great product. We offer it here as well. It's been around for decades, and it's one of the most common anti-aging therapies available. And in the right patient with the right healthcare provider, it can provide great results, which can make patients very happy. But there are some complications that can occur with any aesthetic treatment. And the purpose of today was not to scare you off, but just to educate you. If you're someone out there who's had a complication such as this and you want to get our opinion, feel free to reach out to our office and we're happy to see you. And thanks again for watching Unfiltered.